Good morning, everyone. Thank you, everyone, for joining us, and happy Nurses Week. This year, for 2024, CNA has chosen the theme of changing lives and shaping tomorrow. This theme recognizes the contributions of the tremendous impact that nurses have made on individuals, communities, and the future contributions on the future of healthcare that we are going to be impacting as we move forward into 2024 and beyond. Today, we're pleased to kick off Nursing Week with Dr. Leigh Chapman, our Chief Nursing Officer of Canada, as well as our special speaker, Don Gugu, highlight how nurses can impact healthcare and how the retention of nurses is paramount to really changing the future of healthcare in Canada. We want to thank CeraVe for their support of both nurses and the Canadians who access healthcare. They have generously sponsored our week events. Just a few housekeeping issues before we truly begin. Due to the large number of participants that are in this webinar, we will only accept questions in writing only during or at the end of the presentation. Please use the Q&A icon below to submit any questions. If you are able to access the chat, any questions in the chat may not be seen by myself, the moderator, and please note that this webinar may be recorded. My name is Misty Forte, and I'm pleased to be moderating this session with you. And to begin our session, I do want to do a land acknowledgement, and that we at CNA wish to acknowledge the land upon which we are gathered today for thousands of years has been the traditional land and home of diverse First Nations, Inuit, and Métis people. I would also like to acknowledge that you are joining us today from many places, near and far, and acknowledge the traditional owners and caretaker of those lands as well. We are grateful to have the opportunity to work and play on this land. We pay our respects to Indigenous people, past and present, and reaffirm our relationships with one another. Make this acknowledgement with the recognition that we are a community of nurses that have a responsibility to learn the harsh and devastating impact colonialization has had on Indigenous peoples past and present. Once again, I want to thank CeraVe for their sponsorship of our events this week, both webinars and our scavenger hunt that we have available on social media if you've been able to take part. At this time, I would like to invite Lena Turkman to come and have a few words, as well as to invite our speakers, to introduce our speakers this morning.
Oh, hi. Hello again. I hope you all hear me right. Yeah,
it's perfect, Lena.
Perfect. Thank you so much, Misty, for the introduction. So I come from CeraVe. I just wanted to hop on here, say happy Nursing Week, to everyone. It's very dear to CeraVe to always be able to support the nurses, because we know how important you are for our health system. So thank you so much for all that you do. And I wanted to introduce Dr. Leigh Chapman. So Dr. Chapman is a committed nurse here in Canada. She's committed to advancing the nursing profession in Canada to ensure equitable access to quality care. So as she is Canada's Chief Nursing Officer, and she provides strategic advices to Health Canada. She plays also an important role on key nursing issues and represents the federal government at public forums. So Dr. Leigh is a registered nurse who received also her PhD from the University of Toronto, so the Lawrence S. Bloomberg Faculty of Nursing. Over the past 20 years, she has gained a deep understanding of nursing by working in both frontline and clinical leadership capacities. In addition to her federal role, Dr. Leigh also continues to work at a community-based consumption and treatment site in Toronto, where she provides harm reduction services and frontline care. So here, Dr. Leigh, for you.
Thank you so much, Lena. Thank you, Misty. Bonjour tout le monde. And happy Nursing Week to all. I'm absolutely delighted to be joining you today. I am on Treaty 13 territory here in Toronto. They're traditional territories of the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, and the Wendat and Huron people. And delighted to wish you all a very happy Nursing Week. So bonjour à toutes et tous. I'm delighted to join you here today and wanted to wish you bonne semaine nationale des soins infirmiers. I have a few slides. I thought I would share some information on the Nursing Retention Toolkit. Hopefully you've all heard and felt the buzz of the Nursing Retention Toolkit across the country, but I thought I would get into it a little bit because when we think of all of the various priorities in terms of our health workforce in Canada currently, there's nothing really more important than focusing on nursing retention. And this is the strategic reset that our system needs in terms of how we are valuing the essential work that nurses do and how we are also improving the working lives of nurses in Canada. So we'll just go through to the next slide, which provides a bit of an overview of the toolkit. So this is something that I started working on with colleagues from across the country over a year ago. It was very clear to me that there was a lot of work being done on recruitment, much less focus on retention. And of course, we know that we need to focus on retention to ensure that we're keeping nurses in the profession and encouraging the return of those who may have left both the public sector and the profession altogether. So the toolkit is really the result of this broad pan-Canadian collaboration with the nursing community from across Canada. It was co-created with nurses who were brought together at the Nursing Retention Forum, which was last June of 2023. And the forum was comprised of nursing experts, point of care nurses, nurse employers, decision makers, nurse regulators, union representatives, and so on. It is very much a resource created by and for nurses. And although we all work in an interprofessional team-based context, the participants felt very strongly that this is a uniprofessional nursing retention toolkit. I'm sure it has applicability to other health professions as well as health and social services, but there's a lot of work being needed to be done on our largest regulated health workforce in Canada. And so we think that it actually focuses on nursing professionals at all career stages, including nursing students. Retention really starts in nursing education programs to ensure that seats, nursing education seats equals graduates, that we don't have attrition in nursing education, and that we're able to retain nurses very early on in their career. The toolkit is really aimed at providing employers, health authorities, and healthcare organizations with practical strategies and tools to improve nursing retention across the country. So I'll go to the next slide. And you can see here the guiding principles that we used when developing the toolkit. We wanted the recommendations to be actionable. We know that work is needed now. We have I think suffered greatly as a profession as a result of the COVID-19 pandemic and the current health workforce crisis. And so we need some things that are implementable in the short term. Also values-based, again, the values being respect, anti-racism, anti-oppression, transparency, and accountability. And these are the values underlying all of the themes. We think that the tools are high impact. So the initiatives are all aimed at the organizational or structural level. They're not aimed at things an individual nurse should do to improve their own retention. They're really aimed at the structural organizational level. So it's systemic challenges at the organizational level that are faced by nurses in their career phases and positions. Again, organization focused and then future focused. We know that there's a lot that we need to do to improve nurses' experience, and there's many tools that we can leverage and implement to really future-proof the profession and our contribution to care. So we'll go to the next slide. So here you see the wheel, the 8 color-coded themes that you have in the outermost circle, the innermost the innermost circle, you can see the values that I mentioned: respect, transparency, anti-racism, anti-oppression, and accountability. And we think that these color-coded themes on the outside are themes that impact a nurse's day-to-day working life, primarily in the domain of clinical care. So we'll go to the next slide, please. Okay, so this is just really an orientation to the toolkit, that each theme has a goal statement followed by 3 initiatives, except for safe staffing practices, which just has 2 initiatives. And there's a similar sort of rubric to each of the themes, where there's a description, an intended outcome, target population, and then the involvement of nurses or role of nurses and nursing stakeholders, and then the reference, resources, and examples. And I think it's really in those reference, resources, and examples where all of the detail is provided in terms of organizations across the country that are already doing these initiatives focused on nursing retention. So we'll go to the next slide, please. Perfect, thank you. So here is the toolkit content. You can see the themes, the 8 color-coded themes, the goal statement for each, and then the initiative in that final column. So fairly similar structure. And the next slide just provides some additional detail. Right, perfect, thank you. So inspired leadership. Obviously, the goal of inspired leadership is to empower nurses of all levels, roles, and settings to experience fulfillment in their work and become leaders within their organization. All of the forum participants felt like this was an area that was really lacking, and that leaders are especially challenged, and we need more structural support for leaders to ensure that they're able to retain nurses and lead from where they stand within organizations. So hard to cite all of the examples here, but we've just listed a couple so you can sort of see the breadth of examples provided. And I should say that over 90% of the examples are Canadian initiatives. We had some exceptions where we drew upon international examples where we didn't have a Canadian equivalent, or where it was an example of something that really was used and implemented across Canada. So you can see initiatives, resources, and examples here for cultural change, leadership competencies, and then emerging nursing leaders. For emerging nursing leaders, we highlighted the Michael Guerin Emerging Leaders Program, which is a year-long hospital-based initiative to really upskill staff to provide opportunities for leadership development within the organization. And then under cultural change, we highlighted the nursing councils in Quebec, where there's a role for nurses to play in quality improvement, quality councils. And these are really independent from management. We really tried to differentiate leadership from management competencies and focus on what was needed at an organizational level. So we'll go to the next theme. And I should say that although they are listed sort of sequentially, there's no order to the themes, which is why we have them in a wheel. So because we think that they're fairly iterative. Flexible and balanced ways of working is probably one of the themes that's getting the most attention. The goal is really to promote nurse autonomy and flexibility in scheduling and career progression. And no shortage of examples here, but I think this is really where we need to focus some of our efforts when it comes to flexible work design. I often cite the Manitoba Provincial Nursing Float Pool. So this is a float pool within Shared Health, which is the Provincial Health Authority, and this is in collaboration with the Manitoba Nurses Union. So nurses are able to be afforded that flexibility that they so desire, but within the public sector. Self-scheduling guidelines in the Newfoundland and Labrador provincial guidelines. And I think this is something that nurses really want. They want to be able to self-schedule. So hopefully we'll see more of this implemented across the country. And then workplace resources and amenities. There's actually a lot of these opportunities popping up across the country. I know Newfoundland just recently announced daycare for shift workers. And we've provided the example of Sick Kids housing for staff. Maclean's magazine also recently came out and said that all of these things like housing and transit subsidies, parking subsidies, these are all needed to support essential workers like nurses. So it is in the public media or in the mainstream media as well as being recommended in the toolkit. Okay, so we'll go to the next slide. Organizational mental health and wellness supports. It is Mental Health Awareness Week, and it's very important for us to think about bespoke resources that are needed for nurses within the organization, ensuring that we have appropriate and effective preventative and acute health and wellness supports, focusing specifically on mental health supports. So we highlighted several initiatives here under Zero Tolerance for Violence, Bullying, and Racism. There was a collaborative declaration by CNA and many other organizations against anti-Black racism in nursing and healthcare. And this is an area that we know needs focused attention across the country. The Canadian Black Nurses Alliance was part of this group as well. The Pan-Canadian Association of Nurses of African Descent, and the Canadian Federation of Nurses Union, among other organizations. Under moral distress and injury care, this is something that really has emerged quite prominently out of the pandemic, that nurses need bespoke, specific resources for moral injury. So we've provided the example of Health PEI in their partnership with Mind Beacon to provide third-party mental health support for nurses. And uptake has been higher than in-house EAP support. So I think this is something to be mindful of, because often we rely on EAP supports, and often nurses are either skeptical about EAP or it doesn't sort of hit the mark in terms of what's needed. So this is an example of a third-party partnership that has been effective. And then best practices for vacation and time off. I know many jurisdictions have unis or undergraduate nurse employee programs, but we've highlighted the program in Alberta with United Nurses of Alberta and the Alberta Health Service. Okay, so we'll go to the next slide. Professional development and mentorship. So this is certainly something I think that we have often taken for granted in nursing, that we always will have opportunities for professional development and mentorship. Many organizational leaders talk about the need to actually focus on third-party investments, whether it's philanthropy or private donors to really support professional development, that many organizations do not have resources for professional development and mentorship. But this is essential to ensure that nurses are able to stay abreast of changes in the healthcare system, to enhance their skills, and certainly to promote their career goals. So we've highlighted 3 initiatives here: the transition programs, Nova Scotia's International Community of Health Workers, their engagement program for IEHPs, or Internationally Educated Health Professionals. Under mentorship programs, we've highlighted UBC's mentorship program, which is a really great example of partnering a senior nurse leader, senior nursing students with alumni as they enter the workforce to help ease that transition into practice and provide some formal mentorship opportunities. And then, of course, under career pathways and bridging programs, there's many, I think, across the country that are emerging, but we've highlighted the New Brunswick Step Up to Nursing initiative. And this is for all categories, for bridging from personal support worker to all categories with salary and tuition support. And this is a really popular route for many nurses across the country to enter into the healthcare field as a personal support worker, as a healthcare aide, and then bridge to regulated nursing in some aspect of regulated nursing amongst the three generalist categories. Okay, so we'll go to the next slide. Reduced admin burden, this is definitely getting a lot of attention as well. It's important for us to free up nurses to really focus on the essential and core aspects of care. And we've focused on 3 initiatives here. Work redesign, we highlighted RNAO's guidelines for developing and sustaining interprofessional healthcare as one example. Under digital preparedness, there's a lot of work to be done in this area. We highlighted CNA's work with the Canadian Nursing Informatics Association, because having a nurse informatician is really important at the organizational level to ensure digital preparedness, and also to reduce the administrative burden of nurses, to ensure that we're providing digital support tools to really focus on allow nurses to focus on work that is essential, and try to automate things that can be automated. Under documentation requirements, we highlighted, again from New Brunswick, Horizon Health's Forms Committee. It's really important to streamline forms and streamline documentation requirements and ensure organizational requirements don't supersede regulatory requirements, as they often do. Because it just creates more work for nurses. Okay, so we'll go to the next slide. Strong management and communication. Again, as I mentioned, we distinguished between leadership and management, with management really being focused on someone in a management role. We think that there's an opportunity to have more mutual respect between managers and point of care nurses. So under the 3 initiatives, so the first one being nursing management competencies, we highlighted McGill's strengths-based nursing and healthcare program. This is internationally renowned. It's a really innovative online program providing training and then mentorship to help augment leadership skills. Under supporting nursing leaders, we highlighted Nova Scotia's 90-second nurse program, which provides psychological support for nurses and helps promote their well-being. Under nurse engagement and listening, we highlighted the CMHA's Your Health Space as an example, as an organization that provides a space for healthcare organizations to really help to broach some of these challenging conversations around mental health. Often participants at the nursing retention forum said that managers are often unwilling to have conversations because they don't know how to handle the information. So really important for managers to have this sort of trauma-informed approach when having conversations with staff. Okay, so we'll go to the next slide, please. Clinical governance and infrastructure. There's many examples of organizations that are doing this exceptionally well across the country. And these are but a few examples, but it's essential for nurses to have a key role in decision-making and really to be at the forefront of driving the development of sustainable health system. You know, we often would say that, and it is true, that nursing is the largest group of regulated health professionals in Canada. We're almost 500,000 nurses strong in this country across 4 categories of licensure registration. But it's also important to listen to the perspectives of nurses, not just because we're so numerous, but because we have a key role to play when it comes to health system redesign and transformation, because we are often most proximal to the point of care and have a very broad holistic perspective. So involving nurses in decision-making is really key in ensuring that there are supportive clinical governance and infrastructure approaches in place so that nurses can be involved. So under these 3 initiatives here, structured participatory governance, we highlight the Ottawa Hospital's Corporate Nursing Clinical Practice Committee. Of course, there's many examples of participatory governance across the country. It's always very exciting for me as CNO to hear about nurses being involved in practice committees or practice councils and so on. Under nursing shared governance, we highlight AHS Co-Act Collaborative Care, which is a really great example of ensuring that nurses are involved in having a key role in collaborative care and quality improvement in the practice setting. And then under nurse-led models of care initiatives and practice standards, again, there's many examples of this from a pan-Canadian perspective, excellent examples of nurse-led models across the country. We highlighted Winnipeg's Regional Health Authority Professional Committee, which is a great interprofessional or interdisciplinary committee where nurses have a key role in some of the more policy issues around interprofessional clinical practice. And I should have said this at the beginning, that these examples that I'm showcasing here under the initiatives are just a teaser to hopefully invite you to go to the toolkit on the Canada.ca website. I think the link is in the chat because there's many more examples in the actual toolkit. Okay, next slide, please. Okay, so this is actually the last theme, safe staffing practices. Again, one that's getting a lot of attention. And the goal of this is really to support physically safe and psychologically brave workplaces by implementing staffing practices that reflect things like patient acuity, nurse experience, and work-life balance. So we highlighted clinical supports, the Prairie Mountain Health Emergency Department new graduate program as an example of new graduates being supported as supernumeraries and to be buddied with an experienced nurse, similar to the new graduate guarantee programs that have existed in many jurisdictions across the country. This is a wonderful example of ensuring those clinical supports exist as new grads transition to practice, because that's often when retention is in peril, that if new grads aren't supported, we don't want them to successfully complete a nursing education program only to exit out of the profession. We absolutely need their expertise and want them to be supported. And then under safe staffing frameworks and tools, again, an area that's getting a lot of attention, we highlight the Canadian Nurses Association and CFNU's evidence-based safe nurse staffing toolkit. So this is a really great initiative that highlights all of the things that go into, that must be considered when looking at safe staffing assessments and safe staffing frameworks. And of course, I would be remiss if I didn't mention the BC government's recent announcement in collaboration with BC Nurses Union to implement safe staffing ratios in BC, and the Nova Scotia government also following suit recently in their round of bargaining with the Nova Scotia Nurses Union in their agreement to support guaranteed minimum staffing. So this is obviously an area that's hugely popular and gaining a lot of traction across the country. Okay, so we'll go to the next slide, please. Thank you. So this is really just to give you a bit of a teaser of the toolkit itself. Of course, we know that retention costs money, that it's not cost neutral, and it does require focused investment in how we are evaluating the nursing profession across the country. We do hope that the Nursing Retention Toolkit is essentially a playbook for employers and health authorities to implement to foster positive change. We really encourage sharing of the toolkit through social media, through emails, staff meetings, through established channels. Connect with facilities and organizations across the country. We hope that it does break down some of our bureaucratic silos and really promotes opportunities and examples that can be scaled and spread. And then we certainly hope that all of the emerging practices and best practices that we've highlighted in the toolkit can be implemented across organizations and health authorities across the country in support of nursing retention. So I will, I think that is the last slide. Yes, thank you very much, Misty, for advancing. And I welcome I think we have time later for questions, but merci beaucoup, and have a look at the Nursing Retention Toolkit on the Canada.ca website. Thank you.
And Leigh, we did put a link to your toolkit in the chat for anyone to access. Thank you, Leigh, for sharing that. And we know that this toolkit will be valuable for all nurses and organizations in our efforts to keep and retain our nurses here in Canada. I had the pleasure a few months ago of meeting a nurse named Dawn Gugu out in Nova Scotia, and to learn about a project that she is undergoing, really working at retaining nursing students at Dalhousie University that really exemplifies a lot of the tenets within the toolkit. We had the pleasure today of inviting Dawn Gugu to come and speak to us, and I'm so pleased to have her here today with us. Dawn is the Nova Scotia Chair in Indigenous Health Nursing. She's a Mi'kmaq status member of the Wikoba First Nation, and she's a nurse who's really innovating nursing student retention from the onset of their nursing studies, and very much exemplifying a lot of the tenets that Leigh just spoke about. At this time, I'd like to invite Dawn to join with us to tell us a little bit more about her initiative. Just before you start, Dawn, if anyone has any questions for Leigh, again, please put them in the Q&A at the bottom of the screen, and we'll have some time for questions after Dawn's presentation.
Hi, everyone. Gwe. I'm from Wikoba First Nation. It's a small Indigenous community in Cape Breton. So I've been working as the ONU Nursing Initiative lead here in Nova Scotia that's supporting students with recruitment and retention coming into the nursing program as Indigenous people, the barriers that are, really causing a lot of that for us to get into nursing, I guess. So my journey kind of started with coming into the nursing profession later on in life. I was a medic before in the military, so I really enjoyed caring for others, but I was always scared to go to university. So when I started nursing, it was a different world for me in the sense that I was first time learning about how sick and poor and our death rates were within our Indigenous people. These are things that you really were not educated on in the past that had happened to us. We just know we're treated differently. So when I was going to school, I realized a lot of, I educated myself really on the past, and I felt like when I finished school, it was more that Indigenous people were a burden to the system as opposed to learning about Indigenous people. And I didn't really like how I felt about that. And then I went into nursing, and I always say it, Indigenous nurses have two jobs. First, they're a nurse. Second, they need to help educate everyone, their coworkers, their patient, and Indigenous patients on how to use the system. So of all this experience, my concluding thought was, we need more Indigenous nurses. We need to know each other. We don't know each other. And it's when we're in the same environment that we start asking each other questions. And I remember when I first started in the nursing profession, the most difficult part was people would ask me the stereotypes that they have known in the past as opposed to our culture. So I really, I was uncomfortable because I didn't know how to answer those questions and how to change it into, do you want to learn more about my culture? I just want to share a personal story of what happened this weekend. We have a little girl from home that's in the hospital here, and we went to go visit. She's a relative of mine, and a bunch of people from my community were all in the hallway, of course, big old happy get together. And I went into the room and we had a chat, and we were talking to parents. There's a bunch of us in there, and they had mentioned that they usually smudge every morning, and they were asked to leave a certain area. And I felt very bad in the sense that they were scared to ask and nobody asked them. So again, that bringing back together of not knowing each other, so I did connect with the nurse, and we had a great conversation, and the family was connected to the resources that they would need for their cultural traditional ways. So wasn't going to share that, but I just thought I'd add that in because it's still happening, it's happening every day. So, when I started doing this work, I started realizing that we needed, how do we do this? How do we get more Indigenous people into nursing, feeling safe, able to speak up about the experience they're having, and really being heard. So I saw this framework that was by CASN, which is the Canadian Schools Association Schools of Nursing. So they have a framework that responds to the TRC, and within that framework, they have like foundational strategies, recruitment and retention, and strategies to target the curriculum. So under each of those, there's certain things that fall under that. For reconciliation, it's the partnership, faculty and staff training on Indigenous people, which I mentioned before. Like, there's a difference between teaching the material you see in the book as opposed to really understanding what you're teaching. Institutional respect, a welcoming environment, and then designated seats, pre-admission outreach, supports, cultural supports, and disruptive delivery. Like, really thinking about those different ways of how you can support Indigenous students. I always say within writing a paper, because I really struggled with this too, is like, we like to say stories. I just said a story earlier. And when I help a student with their paper, it's a story. It's so deep, and it's something we're not used to writing on paper. So, and we don't want to share it with anybody, you know, and a solution within the university is the Writing Center. Well, Writing Center is not somebody we know, not somebody we want to share our story with, not really somebody we even want to share the story with our professor, but we're telling one person, so it's okay. So, I usually, when I help guide a student, I usually still use their story and the rubric. So trying to teach them how to use both, which sometimes is hard, and more so in the beginning years. But as they progress, like, there's not as much support that's needed, but just that foundational support. And usually when I start with that work, I have to spend a couple hours of building confidence, allowing them to say how they feel about even writing the paper, and not understanding what is being asked of them. I recall I had a roommate one time years ago, and she had just left home, and she said she came home and she started writing all the words that she has never heard before. This is her first time hearing these words, and she said, everybody talks like this in school and I don't know what they mean. So I'm like trying to learn, and I'm also looking up all these words that we don't use on a regular basis. It's not that we don't use them, it's that it's not on a regular basis. And it reminded me of my way of writing a test. You read it in a book and it has the word that we don't know. I'm going to use implementation because that was my word in second year, implementation. And I'm like, what does that mean? And I never knew what it meant. So I finally raised my hand, and, I felt very uncomfortable when I realized, like, I knew what the word meant. But then when you get it in a test, they also use another word, which I didn't look up that word. So those are the type of things that, that really need to be realized with this education for us, coming from, especially the first generation, coming from our communities. And, even with that first generation, my mom, when I called her to tell her I was going to university and I was struggling, it was, come home. There was nobody ever graduated in our community. Nobody ever said, you can keep going or we'll support you. It was like, you don't need to do that. Come home. And that's typical. Like, that's typically how, that's my mom's way of caring, is to come home. So, anyways, I'll continue on. So some of the strategies under curriculum would be, teaching the history and the knowledge and the culture and anti-racism, and having that culturally safe environment. So I'm a little nervous, so I went really too fast. So if you guys have any questions later, just let me know. So with this, my biggest thing was we need more Indigenous nurses, like I said, to know each other. So my solution was very simple, was to start to get into the school, to be in these schools of nursing, and to make those relationships within the schools of nursing, the faculty, and help the people within our communities to come into the school and help guide them and support them. So with that, I met the chair of Indigenous Health Research in Nursing, Dr. Ladmer, and together we started working together, and she asked me what I was doing. She said, "Who's doing this now?" And I said, I don't know. I don't know who's doing this, and I don't know of anybody doing this. So she said, let's do it then. So with her funds, we created a support system for the current students, and also just reaching out to others about the nursing program, and really educating people on the differences in the nursing programs as well. And that first year, we had so many people reach out that wanted to be a nurse. But of all the people that reached out, only one had all the requirements to get into nursing that day that they contacted me. And, there's also those factors that people are not aware of, which is the history of the education system for us, is that within our communities, the budget that we get for the schooling is almost half of what a province would get. So that also means that we don't get certain programs like biology and chemistry, and a lot of focus is on culture, but that also needs to be there, as in to help bring the pride back to who we are as people. And so to get into those programs that you need to get into nursing, you have to go back to school again or find a course somewhere else. And I've had some people that were successful into finding a course somewhere, and now they're in nursing. And every time I help somebody into nursing, I'm so proud. I feel like I got in again. It's very exciting, and just helping guide somebody through that program and into nursing. And so the one person that had all the credentials that day, I looked at the deadline and it was the next day, and I said, "Oh my God, do you want to go, like right now? Like, do you want to apply?" So that day we worked together. He applied. He ended up doing the CASPER test, and now he just finished his whole first year of nursing. And so I'm pretty excited about that. So that's kind of what we kind of worked together, and we did submit proposals to create the system. Like Leah had mentioned, everything requires funding. Like this needs money to get going. So we started putting in proposals and really making a path for this to happen. So we have our own, within the CASN framework, we've kind of used that as a guide and to make our own framework here in Imagi, which is like the pre-admission engagement supports, which is community engagement, application prep, admission pathways. So, CCA, LPN, RN, hopefully to beyond RN, as we have a hard time. Many don't want to go back to school once they finish that undergraduate degree. And then the nursing engagement supports. So that's going to be the learning environment, the curriculum, and into practice. So we do have a chart here, but I won't go into it. So a scan was done by Fletcher and Mendeley in 2021 about the TRC. So the Truth and Reconciliation was out in 2015, and it had recommendations that were for the schools of nursing and for health, which, it had to include the history of Indigenous people. So they wanted to examine the extent on which these programs were creating culturally safe spaces, responding to the TRC, and including Indigenous content. So they used those three main themes as the indicators on what the schools were doing across Canada. So within their research, of the 107 nursing programs across Canada that they had looked at, only 1/5, that's about 20, met all that criteria, all three indicators that they were looking for. Half included the culturally safe spaces for Indigenous students. 20 satisfied the 24 calls to action 24, and 1/3 were seen to be infusing the Indigenous history into their curriculum. So with that, hopefully we all start working towards it. But anyways, there's two articles that are, one is a little bit older. It's the Pine, it's called Pine Pathways to Indigenous Nurse Education. It's in Manitoba. They started in 2007, and they've had a successful program on helping Indigenous students with the recruitment and retention. And recently, a new article that came out of the States, 2023, and it's an Indigenous model to support nursing students' success. So within this article, they share all the things I had mentioned, but all the supports they use to guide the students. And they have an 85% success rate with this program that has just started in 2018. So this is something we hope to happen in Nova Scotia. Nova Scotia we're not in these schools. We're not there to help support and guide our people into the programs, which I say, if we're not there, if you got to see it to be it. So within our communities, we don't even know who to go to get into nursing. So this is what this work is hopefully going to work towards. So with the proposal that we put through, we did get funding to have a provincial initiative so that all schools of nursing will have an Indigenous nurse hired to support this recruitment and retention for Indigenous people to get into nursing. So anyways, and I want to wish everybody, I love being a nurse, so I'm very, very, I'm so happy to share all the time. Sometimes I overshare, but that's another thing that some people don't realize is that when you do ask an Indigenous person, it's sometimes their first time leaving their community, and they are not comfortable asking certain things and answering certain questions, particularly the stereotypes, and they are asked from our patients to our coworkers. And I'm very open to answering some of those questions, but just to learn and understand that many may not be open to sharing. So anyways, I'll stop there. Misty, happy Nurses Week, by the way.
Happy Nurses Week, Dawn, and happy Indigenous Nurses Day as well. I was remiss in not saying that earlier. We do celebrate you, and the work you're doing is just amazing. Drawing those nurses in and helping them feel more at home when they're at Dalhousie or away from their homes. I know that can be, for anyone, it's terrifying, and I think navigating a whole colonial-based system is even that much more terrifying for many of these nursing students coming in. So I'm eager to see your program grow and flourish and maybe even pop up in new schools throughout our nation. And even from an organizational standpoint, as they're hiring new nurses, can probably take some of these tenets back to help support their staff as they start on their journey. We do have some time now. We have about 11 minutes for questions and answers. I see that Leigh has already jumped the gun and has answered a few questions in our Q&A. If anyone has any additional questions, please go ahead and post them. And hopefully we can get through them. One question that's come up is, Dawn, what does the new mean or translate to? Thank you for your brief work.
Thanks. Ulnu means Indigenous in the Mi'kmaq language. So I try to ensure I use it, as Mi'kmaq is now an official language in Nova Scotia. And I'm hoping that this word will go across Canada. So it's Ul, like as of your ill, so Ulnu, and it means Indigenous. So.
Perfect. Thank you, Dawn. Ashley McClellan asked, this is great. Where can we find a recording of this webinar? We hope to have a recording of the webinar up on our website shortly after, and it should be available also on YouTube through our CNA account if you want to give us a follow. Leigh, do you mind if I go back to some of the questions you answered already so everyone can hear? Or
Sure, that's fine. I also was just going to thank Dawn as well for her leadership, and I think you very clearly articulated, Dawn, the structural barriers that often impede Indigenous nurses even access to nursing education. So we have to start at recruitment when it comes to Indigenous nurses in Canada. Of course, retention is a focus for all nurses, but with Indigenous nurses specifically, we actually have to focus on recruitment because we need more in the profession. And I know that there's many structural barriers as you've described. And you know, as you've also supported nurses to overcome or to contend with some of those structural barriers. So thank you for your leadership.
Thank you. Actually, I'll just introduce those videos, Misty. We just made 2 videos for the recruitment and retention within the province, and 2 are elders that were nurses way back in the day, and 2 are current nurses. They're a husband and wife team, and the husband is now he's the manager of the new nursing home in one of our Indigenous communities in Nova Scotia, which is a first. So I'm very excited and honored to, like, this work has made me even closer to the nurses within our province. So
thank you, Donnie. Gail asks, I heard Leigh mention the importance of a trauma-informed approach when supporting staff. Is this part of the recommendations? How do we build capacity and compassion with all staff?
I mean, it's definitely, you know, from my perspective, it's under the management competencies, but it also might come up under the inspired leadership competencies and the mental health and wellness theme as well. So under all 3 themes, I think you'll see that come up. Definitely when it comes to management, it will come up in the approaches of managers. It will come up under that management competency. But I think, you know, I would say that we really jumped to talking, you know, certainly when I started in the role in 2022, we jumped to talking about having a resilient nursing workforce. And many nurses actually feel completely gaslit by that term resilience. We need resilient systems. And I would argue we need vulnerable individuals, and we need to create space for that vulnerability. And provide supports. And so that's where the sort of trauma-informed approach is highlighted in the toolkit as a means of addressing the needs of staff.
Okay, thank you, Leigh. And this question is for both of you, so we'll give you each time to answer. What do you think that the nursing community can do to help move things along? I think in respect to the toolkit as well as in respect to your project, Donnie.
go ahead, Leigh.
Oh, I was going to say
you put you on the spot first.
Okay. I mean, I think that we need to be talking about retention. Absolutely. We need to be really highlighting this as you know, I think we're going to start to hear more of this over the summer. It's already making the media around emergency departments closing and the lack of, you know, nurses, you know, being attributed to sort of the cause of why emergency departments are closing. And, you know, organizations are already spending an inordinate amount of money on filling vacancies, and we need that strategic refocus on retention of the nursing workforce. It's not to say that we can't, we don't have to simultaneously focus on recruitment. But unless we're actually doing a strategic reset in terms of how we're managing health human resources, you know, this summer will be worse than last, the next summer will be worse. You know, we're all operating in the context of a global nursing shortage. So we need to absolutely do things differently. And, you know, I'm very curious to hear what Dawn has to say for Indigenous nurses. We need to talk about this more. We need to really highlight all the structural barriers that impede access to nursing education and to high school completion, and, you know, having to go and travel so far to go to school, and, you know, let alone all the barriers in all of our institutions in Canada. But I think we really need to highlight these issues as the most pressing issues in our nursing health workforce in Canada.
Thanks, Leah. For my work, I think I mentioned it before, is that we don't know each other. I feel like there's that piece missing on Indigenous education. And, you know, for when 215 happened, that was the most that I felt like that people really wanted to know about our history and about what happened in Canada. And like I said before, we don't even know this history. We're not taught. And I feel like if we were all to really know each other. It's not just to know Indigenous people, it's us to know non-Indigenous people and all the other, everybody. We need to know each other. And that is missing, I feel like. Where we don't know each other, we start losing respect of all our different ways of life, our culture, our even our food, on what we eat, you know. So we need to know each other is my simple answer, I guess.
I would say it's simple, Don. There's so many layers there. It's being open to know each other too. I would think, not that I want to inject myself, but to have that openness to learn and that understanding. I think that's a great answer, Don.
And if I can just add that CNA is a great place to foster that knowing and that understanding, because we can easily slide into the othering. You know, we have 4 different categories of nurse in Canada. We have 2 official languages, 10 provinces, 3 territories, plus the federal government employs many nurses, and we can then get into all the specialties and the different areas of specialization, different sectors in which nurses work. But as a National Nursing Association, you know, CNA is very well positioned to be fostering those conversations, to get to know one another across the country, to really invite that dialogue.
Thank you, Leigh. Leigh, I don't know if you have a minute or two just to reflect on, I know you answered a few questions in the Q&A already about the evaluation. I don't know if you want to share a little bit more so everyone can hear the evaluation plans for your toolkit.
Sure. So we most certainly are going to be evaluating the toolkit. Although we just released it on the full toolkit on March 4th, dissemination actually started last year in the fall. We released the executive summary of the toolkit for the federal, provincial, and territorial health ministers meeting on Prince Edward Island in October. So we are looking at evaluating how it's being implemented across the country. The implementation will really be at the provincial and territorial and healthcare organization, health system, health authority level. But we are looking at evaluating that this fiscal to get some of those early wins, early implementation stories, and then next fiscal as well.
Perfect. Thank you, Leigh. From there, I'm just checking to see, oh, one more. Hi, Leigh, I think this toolkit is brilliant. How do you suggest we bring this up with our employers? Unfortunately, sometimes there's gaslighting and a general idea of historically we have done things this way when new ideas are brought forth.
Oh, that's a great question. I mean, we should all be breaking out into hives whenever we hear we've always done things this way. I mean, we're in the business of providing the public with healthcare, right? And the public's needs change, and we need to be nimble and change. And so we absolutely have to be open to new ideas. I think that, you know, it's wonderful to bring it up through things like shared governance committees, through nursing practice councils, you know, even a unit-based council or unit-based leadership can work together with nurses in the unit to sort of highlight what's important within an organization. It can be used for strategic planning, for like benchmarking to see how we're doing, you know, on, you know, all the 8 initiatives, and maybe that will provide an area of focus for the organization or for the unit. So I think it can be, it's often change is best when it's grassroots, you know, nurses being involved in leading change. But really, I want to stress that the change is needed at the organizational or structural level. So although nurses can raise awareness of the toolkit, the change that's needed is really at the organizational level. But I really hope nurses aren't gaslit, especially you know, during nursing week, but especially given our health workforce crises across the country and our health systems. And I hope that, you know, now more than ever, we are elevating our voices as nurses, and that nurses are listened to and heard and respected across the country.
Thank you, Leigh. I want to thank you both again, Dawn and Leigh, for joining us today and for sharing the great work that you're doing and how it's impacting and changing the lives not only of our patients, but of the nurses themselves throughout Canada. If you enjoyed this webinar, we do have a few more events happening over this week and next that I want to just highlight. More on nursing innovation. We have a leader, sorry, my slide's not advancing. We have a leader in nursing innovation, Mary Lou Ackerman, who is the Vice President-elect of SOCIAL, which is the Society of Nurses internationally that focuses on innovation and entrepreneurship within nursing. So if you want to learn more about how you can impact change, this would be a great webinar for you to attend. We also have next week a therapeutic writing workshop available for all nurses to attend with Lori Rosegrove, and we're very excited to be able to sponsor this and to have her come and help teach nurses the therapeutic benefits of writing. And as always, if you enjoy these events, we do welcome your membership, so please consider joining CNA. So once again, thank you, Dawn and Leigh. Thank you all for attending. I hope that you enjoyed your day today, and happy Nurses Week. I hope that you're able to participate in some of the fun that we have planned this week. And thank you for all the work that you do.
Thanks, Misty.
Thank you.
Thanks so much. Merci. Merci beaucoup.